I wanted to talk a little bit about one of my favorite procedures that we do here at the practice, and also one of the procedures that I get asked the most questions regarding, and that would be the endoscopic cheek lift. It's my favorite because it works a little bit on every part of the face. So whereas the neck on the lower face lift would just work on the neck and lower face, the cheek lift kind of works on a little bit of everything. So when Dr. Cole does a mid face lift or a cheek lift, he takes the meaty part of our cheek and sort of moves it up onto the cheekbone, not above and beyond where it started, just putting it back up where it was when we were younger, and it refills the volume underneath the eye area and then also takes pressure off of the nasolabial folds. A lot of people come in and they have these concerns about their lower eyelid area, and when we start talking about their cheeks, they're a little bit confused because they're here to talk about their lower eyelids, and that can be confusing. But when you think about it, doing a lower lid blepharoplasty might just take away excess skin and fat, but leaves you with some hollowness under there if you've had some mid-face descent. So if your cheeks started to kind of go south like they tend to do, moving it back up is going to restore the volume that we have underneath the eyelids, and then he's able to sort of reposition anything that's undesirable into a more pleasing shape, making the lower eyelid and the cheek one big happy family like they used to be when we were younger. He finishes off that procedure with some laser skin resurfacing, which makes your skin the absolute best version of itself. So you'll still have lines and wrinkles, but it's going to be about 75% better than when we started. And I think it's just a great surgery that, again, touches on so many parts of the eyes, the cheek, and the part of the lower face on the nasolabial folds, and I think people really enjoy their results. It's a great procedure for people that are in their 30s up to 50s and 60s, and it's a great procedure to combine with other procedures such as eyelid procedures, brow lifts, and lower face lifts. So I just thought I would talk a little bit about one of our most interesting procedures and the ones that people tend to ask the most questions about, and that is our cheek lift.